A wholehearted welcome to all participants in this third Impact webinar of 2022 that will focus on sustainability in implantation research. My name is Sabina de Geest. I'm a professor of nursing and chair of the Department of Public Health at the University of Basel, and I am part of the Impact Network, which is a Swiss implementation science network, a network with the goal to connect implementation scientists in Switzerland, but also internationally, to provide education, to showcase projects, and also to lobby for fundraising for implementation science. Our webinars is one of the instruments we are using in order to promote implementation science and as an educational tool. Sustainability is not easy to achieve. We know that implementation is already very challenging, and several numbers are floating around. As little as 14% of evidence is ever translated. We don't have really, or at least I do not know specifically, but even less in view of sustainability, but I don't think this has already been looked at. Anyway, sustainability is our ultimate goal, but is something that takes even more effort than successful implementation. And so having the choice to include the topic of sustainability in our webinars of impact is also because we see that the science around sustainability is gaining traction, and we have the world experts on sustainability in implementation research who joined us today. Dr. Rachel Shelton, she's from Columbia University, an associate professor of Columbia University in New York. She's a social and a behavioral scientist. She has training in cancer and social epidemiology, and she has expertise in implementation science, sustainability, health equity, and community-based participatory research. So within the Columbia University, she is part of the Mailman School of Public Health, where she is the co-director of the Community Engagement Core Resource at the Irving Institute for Clinical Translational Research. And she also leads at Columbia a new university-wide initiative on implementation science. Dr. Shelton has a huge experience of teaching implementation science nationally and internationally. And we are so glad, Rachel, that you are part of our impact network today, and that we will benefit from your expertise and vast experience in view of sustainability in implementation science. To you the floor, Rachel.
Thank you so much for that kind welcome. I am so honored and thrilled to be here today to talk about this area of sustainability, which I think that there are just so many important opportunities and gaps. So I'm happy to share this knowledge, and I probably won't get to all the content, but I'm happy to share slides, and I'm hoping that we can have some great discussion and questions about this as well. So first, just to kick it off, I just wanted to do a bit of a poll just to get a sense of the work that people have done to date in sustainability. So first question, if you can just enter in, have you ever measured sustainability as an outcome in your implementation research? Okay, looks like there are lots of answers coming in. Okay, so looks like almost 70% have not. Some are not sure, and 23% have. So that's great. So some people have experience with this, but as you can see, this is not a common outcome in our implementation research. Next question, have you ever had your research on sustainability funded in implementation science? pretty similar breakdown to the people who've measured it. So that might map on to whether or not it was funded. Those might be the people who are measuring it. So about 68% have not, and about 21% have. So that's great. So as you can see, a lot of room for growth and opportunity in terms of both getting this work funded and also thinking about explicitly measuring this and planning for sustainability. So if you can take the poll down, or I'll just close it actually, it looks like. Is it possible to remove the poll part?
Literally, you can just click yourself on the cross at the upper level, and then it will disappear. Yes.
Got it. Hold on one second. Let me close that out. Okay, perfect. Great. So for today's talk, I am first, because this is a newer area, again, the science is really developing in this area in the past, 5 to 6 years. So I'm going to first lay out a lot of the definitions, give you an introduction to what sustainability is, think about some of the measurements and frameworks, tools, and resources. And then I'm going to take you through the journey that I've been on in the last 10 to 12 years in terms of developing empirical research in this area. And then really talk about some of the really important opportunities we have for advancing science on sustainability in the context of implementation science. So that is the plan. So many of you here today are here because you are doing work or you're interested in doing work in implementation science. So you all know the focus of the field is really about the how. It's what are the methods, the strategies, the frameworks we can use to actively promote the adoption and use of all the evidence-based interventions, guidelines, and programs we have that are not being widely distributed and need to be to actually have an impact on population health. And I love that that's the title of this seminar series. That's the goal of implementation science. So where does sustainability fit in the field and in that definition? So as you can see, if we think about, what we commonly have conceptualized as our traditional translational pipeline. And of course, we know that in reality with hybrid designs and a lot of the engaged work that we do, it doesn't always play out like this. But we know that our implementation research tends to rest on the assumption that there already has been an evidence-based intervention that's been developed and tested. And then our implementation work is really about the how. How do we get it translated in real world practice? So as you can see here, sustainment or sustainability is kind of tucked in there at the very end as the last stage. And I think that it's kind of there as almost an afterthought. And I think that's often what's happened in the field. For very good methodological reasons, for very important challenges regarding funding, we often don't get to it. We might hope to get to it. We might think about maintenance at 6 months or 12 months, but we rarely have devoted really the focus of our work on sustainability. It's often kind of an afterthought. When we think about some of our implementation outcomes, we may be familiar with Enola Proctor's work in terms of all the potential implementation indicators or outcomes that we might include. And again, we can see sustainability or sustainment's kind of tucked in here in the middle as one of many potential outcomes. But again, one that we often don't prioritize. And this has been really consistent as well. This is some work that was done in the US context with research funding from NIH, the National Institutes of Health. And there was an analysis on what implementation research has been funded, what the focus has been historically. Only 3% of studies focused solely on sustainability. So again, people might have included it as one of many potential outcomes, but very little research is focused just on sustainability. In my work over the past 7 to 10 years, I've really tried to make the case that if we want to have impact on sustainability, we need to take it apart as separate from the phase of implementation and think about it as its own domain, distinct from implementation, which might be that first 6 months, that first year, and really think about it as a standalone phase, and really think about it as something that might be much longer term than that initial implementation work, and which might have distinct determinants that need to be considered. So why is sustainability important? Why do we care about it in the context of implementation science? So first, I think we all know, no matter whether we're working in clinical settings, public health settings, school settings, we know that sustainability of evidence-based interventions is a tremendous challenge that we all face. And again, for all types of interventions. Marianne Shire was a mentor of mine, and she was amazing. She was doing work on sustainability in the 70s and 80s. She was way ahead of our time in terms of implementation research. And she was a program officer at the Robert Wood Johnson Foundation, a foundation that funds health promotion programs in the United States. And she did a portfolio analysis of her funded research at the time that she published. And she found that only about 40 to 60% of programs sustained at least one component 1 to 6 years after that initial adoption. And when we think about many of our programs, they're often multi-component, right? It's rare that you just have one component. So that really reflects empirically what a challenge it can be to sustain an entire program that's multi-component. And a lot of recent research has been very consistent. About half of programs are sustained beyond a year. There's some really important reasons why we need to think about investing in implementation research. And I've experienced a lot of these in my own work and with partnerships on the ground. And I think one is really about the accountability. When we think about all the tremendous investments that are made from governments and foundations, from universities, in terms of developing that initial evidence base, right? So much is invested in that. And now with implementation research and actually starting to think about how we implement. But we have to ask, and the public and funders and our partners ask, where's the accountability if that program is delivered or developed, but then not continued? And you hear a lot about this. Some of the community partners that I've worked with just have a lot of mistrust and wariness, right? If there is that investment, all that time and work, and then it's not continued. You also hear about this, you might be involved with an implementation effort, providers might, or leadership might, in terms of that investment of doing that initial audit and feedback or that training, and then it not continuing, and that those time and resources feeling like they have been wasted to some extent. So I think this is a really important issue in terms of the trust and trustworthiness of our research. Anola Proctor and colleagues have also really identified how complex this work is, how challenging it is to do sustainability research, but also just so critical if we really truly want to maximize the translational health and societal benefits of our work. Okay, so I want to say there has been a lot of inconsistency in the terminology with sustainability and a lot of confusion. So you might see words like continuation or maintenance. Sustainability and sustainment are often used interchangeably. I often use the word sustainability, and I'm going to use that term today, but I want to recognize some of the lack of clarity in the literature around this. So initially, a lot of the earlier definitions, here's one by Jim Deering and Marianne Shire, really focused on this idea of the continued use of all the program components of the original evidence-based intervention with the goal of having that continued impact on those health behaviors or health outcomes of interest. I've really tried to make the case in particular that sustainability is really a multidimensional construct and that there are multiple key dimensions of sustainability. And we've written about this in an annual review of public health paper that came out several years ago. So one key aspect of sustainability is really about the extent to which the original evidence-based intervention, the guideline, the program, and all of its core elements continue to be delivered over time. And as we'll talk about in a minute, in some cases that may require the refinements or adaptations that need to happen to enhance fit or to address contextual factors. It's also about the extent to which, again, the original health benefits or health outcomes are achieved. And in some cases, there's been work also capturing the extent to which whatever networks or partnerships or coalitions needed to happen in terms of implementation continue on the ground through the sustainment phase. Historically, there was a lot of approaching and conceptualization of sustainability as just thinking about it as institutionalization, which is really about the extent to which a program has been kind of routinized and made part of, a budget line item or institutionalized in some of the infrastructure. And I think that can be one important component of it, and I often do measure that in my work. But there's a move away from thinking about it only as institutionalization, because there's recognition that sustainability isn't really this static end goal that we're trying to achieve, and that there's now an approach of really much more this dynamic notion of sustainability, which we'll talk about. I love this definition by Julia Moore and colleagues. I find this really comprehensive, where they again talk about sustainability as, this notion of time, that the intervention and the strategies continue to be delivered, the behavior change is maintained, but also recognize that the program may need to evolve or adapt in order to continue to have benefits for individuals and systems. So I love this because it captures that notion of the dynamic nature. When we look at the literature, and I did a large review in 2018, again, there's been a lot of challenges in terms of how sustainability has been historically approached in implementation science. So a lot of it has been descriptive. There was a nice recent review that suggested only about 20% of the research on sustainability has used conceptual frameworks to guide it. A lot of inconsistency in definitions and measurement and terminology. It's often been done retrospectively. So at the end of the study, they might say, or come back a year later and say, is the program still sustained, yes or no? And we know the challenges of capturing that well, both from being retrospective and not capturing some of the nuances in terms of the extent of sustainability. A lot of the time periods have been short, often 6 months, maybe a year, but rarely, 2 years or more. And then there's also been the challenge where people might kind of think something's not sustained because there might not be that continued health impact. But in some cases, there may be a latency period required to actually see some of the benefits and improvements. So again, those have been some of the methodological challenges and pragmatic challenges in the field. There was a really nice review that Shannon Wilty-Sturman did, a colleague at Stanford, on sustainability some years ago that I thought was really, really helpful in both clinical and public health settings. She found that about half of the programs she reviewed measured kind of continued delivery of the program over time. Only about a quarter looked at continued impact in terms of sustainability. And of those that continued, less than half of the programs continued at high levels of fidelity. And this really, what started some of the amazing work she's done on adaptation in the field of implementation science, because she realized that in the context of sustainability, adaptations might be really important. But there was very little information about which programs were continued or not, why they were discontinued, how they were adapted, and importantly, what was the impact of those adaptations on some of our implementation indicators and effectiveness. So a really nice review if you're interested. The other kind of foundational piece that I'll mention that I just love is this work by David Chambers, Russ Glasgow, and colleagues on the dynamic sustainability framework that came out in 2013. And what I love about this is that this really shifted the field away from this idea of thinking about sustainability as this static end goal. And again, recognizing that over time, we need to be thinking about the systems and contexts in which we're working as dynamic, right? The context change. It might go from paper records to electronic health records. The needs of the populations in these settings might evolve. And importantly, the evidence base also changes. So I do a lot of work on cancer screening, and our evidence base has evolved over time. And so it actually makes sense for the programs to need to evolve and adapt in response to that. So again, this really important notion of dynamic sustainability and moving away from this idea that lack of fidelity is harmful in all cases. Okay, skip that. The other
Huh.
Oop. The other important piece I will flag is really thinking about the factors that matter for sustainability. So, when I started doing this work about 10 years ago, one of the assumptions I found was that when people talked about sustainability, they often thought that the only factor that really mattered for sustainability was whether or not there was funding or resources. And we know that absolutely can help. But we also know, and as the empirical literature has evolved in this area, we're realizing that funding is often not enough to achieve sustainability. And in some cases, when there's limited funding, there may be other factors that can help address some of those gaps in funding. And so, just like we think about implementation determinants, there are factors at the policy level, at the organizational or inter-context level, related to the characteristics of the intervention and the population that matter. And so all these multi-level factors we're starting to build an evidence base around for sustainability. And you might ask, how is this different than implementation? Are these determinants really distinct? And I have really tried to make the case in my work that often this dynamic nature is often some of that distinction, right? So our policy landscape, our organizational priorities, these are not static, right? These change over time. So it's important to understand how that might evolve and might impact the sustainability of our program. Often, even if we have some initial startup funds for implementation, again, we often don't have that additional investment and support over time. So one of the challenges with this work is really thinking about and identifying what the return on investment might be of both initial implementation and sustainability of it. We also, one of the biggest issues, which I'll talk about, is this notion of attrition. And I think this is a really distinct factor that is a huge determinant that impacts sustainability, both of leadership and implementers. And then finally, I'll just say I think work on health equity and sustainability really go hand in hand, right? So the settings that are able to sustain these programs are often not the ones that are necessarily serving a lot of the populations and settings that experience the most health inequities. So it's critical that we're thinking about equitable sustainability as well. Okay, so that is a big picture introduction, and hopefully now you have a sense of some of the conceptualization, some of the issues around measurement, and some of the work on determinants. So now I'm going to give some empirical examples to really help ground you in terms of what this has looked like in the field. There has been very, very few studies in implementation science that have prospectively over time looked at sustainability following an implementation trial. And I love this example by David Buehler and colleagues, which actually did a prospective 5 to 7 year mixed methods follow-up at a huge number of sites. I think they were originally at over 100 sites, and their sustainability follow-up was at over 60 sites. So a really large, nice prospective study. Don't worry too much about the details in terms of the different arms, but this program was a sun safety program that was delivered at ski resorts across the country in the United States, and it had 8 components. And what I love about this is the amount of detail in which they tracked prospectively over time the extent to which the different components of the program were delivered. So again, often we've just done that retrospective, was it delivered, yes or no? But they actually tracked the extent to which all of these components were delivered. And as you can see over time, at the 1 to 2 year follow-up, you can see that fewer programs are able to deliver all of them. And again, that shifts even more at the 5 to 7 year follow-up. So really nice descriptive detail here in terms of the extent of sustainability. Again, they did some nice mixed methods work with leadership and with implementers to really understand why were there these challenges with sustainability. And one of the biggest factors they found that impacted sustainability of the program 5 to 7 years out was this issue again of the manager turnover and attrition as a key factor. And again, really this notion of needing some level of organizational stability to really increase the likelihood of sustainability. So again, this is a really nice example if you want to see a detailed, large, prospective implementation science study focused just on sustainability. So that's one example. I'm going to talk now about some of the work that I've done on sustainability since 2010. So this is the first grant that was funded with my work by NCI in 2010. And this was a small study that was funded to really understand these issues of attrition with the idea that that has huge implications for sustainability. So I started partnering with an amazing group of community health workers and lay health advisors from the National Witness Project. This is a group of cancer survivors and navigators that have been doing this work for 30 years in the community. They're an evidence-based program developed and tested and really one of NCI's kind of model programs in terms of enhancing mammography and cervical cancer screening nationally. So when we started partnering around 2009, the biggest issue they were facing was the issue of sustainability and attrition. They had lost about half of their programs. They at the time had 40 programs, had lost about half of them. And were really having challenges with issues of attrition as well. So we partnered with the idea of really advancing the science and knowing it would have an impact on the sustainability of the program. So that is very much what brought me to this work. Again, this is a little bit more about the program. And I'll just say, I'm not going to talk too much about the original evidence base, but this program is actually an exemplar for sustainability. To be in community settings, low resource settings, and to have been sustained for 30 years is tremendous. And I think part of the reason they have been so successful is because this program was co-created and developed by and for the women they are serving. So I just want to say it actually is an exemplar, despite the fact that they have really, like most programs, experienced huge challenges with sustainability and attrition. So again, this is a little bit more about the program itself. So our initial work was a smaller study from the National Cancer Institute. We used a mixed methods prospective design across 8 of the sites nationally that were nested in a number of different public health and clinical settings. And we did both surveys and interviews among 76 lay health advisors and about 8 project directors. And our idea was really recognizing that this issue of attrition has larger implications for sustainability. So that was the initial focus of our work. What are the factors that actually predict the attrition and involvement of lay health advisors and community health workers in these programs over time? When we went to the literature, we found that there was a lot about the impact of lay health advisors and community health workers, these peers who develop this program and deliver it in these settings. But we could find almost no information about the implementers. What brought them to these roles? What supported them? What were the challenges they experienced? Why were they involved? So we first did some work to really understand the implementers and everything that they gained in terms of both benefits and barriers in these roles. So we kind of, again, did some really nice qualitative work and surveys. And we found that many of them came to this work originally because they were cancer survivors themselves and wanted to address health inequities in their communities. But we heard from them as well that some of the reasons they stayed in the program were the social benefits, the social relationships that they experienced through the program with the other women, particularly the cancer survivors, got a lot out of this program. So we then kind of mapped this and said, okay, all of these factors can't actually predict attrition. If we look at this quantitatively and follow them across the 2 years, which of these factors actually predict whether they're involved in the program at follow-up? So this was published in Implementation Science. So again, we took all these factors and then looked at kind of a prediction model. And we really thought, based on the qualitative work, that these social factors would really matter. But what we found is that almost all of them reported this as a benefit. So there wasn't a lot of variability with these individual level factors and these social factors. What we found was the most important predictor of their attrition was really these role related and organizational factors that mattered. So we found that these lay health advisors and community health workers who were based at sites that had really strong partnerships with academic institutions, medical centers, and cancer centers were much more likely to be engaged at the follow-up. And we did a little exploratory work to see what was different about those sites that had that strong partnership. What were some of the resources they were exchanging? And we found that they were more likely to pay them regular stipends, to have a physical space for the program, which is something in community settings we often take for granted. And also hold regular training, so had regular trainings and contact with them. So really, what we really hypothesize is that an important strategy for sustainability is to form these formal partnerships and really identify not only community champions. We often talk about program champions as one individual, but really think about dual academic champions who can help garner and navigate some of those resources for these settings, as well as community program champions. We also found that the longer women were in the program, the more likely they were to drop out, and that there was burnout at some of the sites, particularly some of the sites that were smaller. And we learned a lot about the importance of community recognition and building implementation teams, not just relying on a single individual to garner the program, but really be able to have a team model to plan for attrition and burnout. To have also really clear role expectations and opportunities for building self-efficacy through ongoing training. We often think about training as an implementation strategy, but we've learned through this work, initial training is not enough for sustainability. We need to have ongoing training that can help, again, provide that social support and also provide opportunities for increasing self-efficacy through ongoing training and feedback. The final thing we did with this work was we did some qualitative interviews because we wanted to get at not only this issue of attrition, but also some of those broader factors that matter for program sustainability, because we heard throughout the program that that had a huge impact, again, on attrition. So we did some qualitative work thinking about, again, all these different domains that we know have mattered in implementation science. And dug a little deeper in terms of the project director and lay health advisors' perceptions on some of the factors that mattered for sustainability. And again, this really, I won't go into all of our findings. This is published in Translational Behavioral Medicine, but this really helped us get at much more the how and the why of sustainability, particularly with the partnerships. So we learned a lot more about how those partnerships were allowing them to access low-cost services, referrals, materials, infrastructure. Again, a lot of the things that we take for granted, but really matter in terms of organizational readiness and infrastructure over time. We also learned so much about the external funding availability and type, and how, you know, a lot of our funding is set up, especially for mammography screening and cancer screening, as short-term, unstable. And so that's really hard to sustain a program with that type of modeling structure. We also heard a lot about the sites in which a lot of these community health worker and lay health advisor programs were based, and how many of them felt devalued, and a lack of prioritization, both of cancer screening as well as the health equity issues that they were addressing. And so one really interesting finding was, of all the 8 programs that were based at cancer centers, almost all of them have now become standalone programs because they did not feel like that setting was a good fit to support their work. So again, that fit of the program with the setting is critical. And again, we learned a lot about the different roles, the program champions, and the leadership that really mattered. And it's interesting, we often think again about program champions and leadership at one level, but this really helped us identify the leadership and champions at multiple levels, both at the local sites and at the national level, in terms of the organizational infrastructure provided by the program nationally. So again, it really helped us contextualize many of our quantitative findings. And again, the full qualitative findings are described in that paper. So again, we learned through a lot of this initial work that multi-level context really matters for both attrition and sustainability. And again, all the barriers related to the organizational infrastructure, the limited stability, the lack of valuing of the program, the burnout, the limited funding, all of these were huge barriers. And we also learned about some of the facilitators in terms of some of the sites that were able to sustain the program. So what we did is we published a lay health advisor sustainability framework. And we were really fortunate to have the American Cancer Society then fund us to actually empirically test over a 4-year period which of these factors that we learned about actually predict long-term sustainability of the program. So we are in our final year of a 4-year study. This is a prospective national study at 16 sites. We have enrolled 200 lay health advisors and leadership at the sites. And again, we're really doing a mixed method study. So we're doing a comparative case study to look at more sustained sites, moderately sustained sites, and sites that have really been inactive or struggled with sustainability, and to understand, again, differences in terms of the factors that matter, and also see which of these factors actually predict at baseline and follow up sustainability. Here are some examples of the outcomes we are measuring. As I mentioned, sustainability is really multidimensional, so we're trying to address that in our research. So we're looking at the continued delivery of the program over time in terms of number of educational programs. We're looking at the number of active lay health advisors and looking at attrition as well. We're looking at the continued health impact in terms of the number of women reached and screened through the program. We are looking at institutionalization. There's a lengthy measure for that we have had to shorten a bit, but we are capturing that. And we're also looking at self-reported sustainability, their perception of the extent to which the program continues. One thing that's been so fascinating is that, because we have been partnering for so long, we actually have data now. We'll have data from 2014 all the way to 2023. And we'll have about 10 sites where we have complete data in terms of those sustainability outcomes. So this has been really interesting. And we tend to see the sites that tend to be more sustained and active are pretty consistent. You can see those are the ones here in the blue. The moderate are the yellow, and the less active are the gray. So it's pretty consistent, but again, huge variability year to year. And doing this in the context of sustainability has been really interesting because a lot of most of the programs have had just tremendous challenges in terms of sustainability. So what we've been finding, so now we're starting to map a lot of our initial work from 2010 all the way up until now and look at some of this data. And again, what we're finding really seems to matter the most in terms of sustainability are these outer contextual policy factors, these partnerships, the alignment with policies and systems, the nature of funding, and how that really then influences that organizational context, that capacity, that readiness, that infrastructure, and those champions. So those are what we are learning is really critical. Just a couple examples in terms of the comparative case study findings that are emerging. So again, this notion that those sustained community and academic health system partnerships and champions are critical. Again, because of all those resources that they help provide access to. And again, this notion of really this alignment of the organizations, the funders with the program. And not just alignment, but actually respect and valuing and communication of the valuing of that program we have found to be really critical. At the organizational level, again, this notion of ongoing training and ongoing capacity building, not just thinking about initial one-time training, but what does that look like over time, particularly if we want to retain the implementers in these roles. That's really critical. And one thing that we've learned, again, we've talked about this notion of dynamic sustainability, is that, again, we really need ongoing adaptation of the program over time. As I've mentioned, the science has changed in terms of the screening guidelines, so the program has need to evolve over time. And then we've really seen amidst COVID in the past 3 years, the program has really had to adapt and evolve to address some of the social determinants, issues around food insecurity, housing, vaccination, that really has to come first in order to even get women to get screened. So again, the changing context really matters for sustainability. This is just an example. This is some of the data from 2020 during COVID, and you can see here most of the sites are reporting COVID as one of the biggest challenges. And at the D&I conference in December, we will be doing a session on some of our learning from the community-led adaptations that happened during COVID as well. Okay, so now what are we doing with this work? I'm going to wrap up in the next 5 to 7 minutes. So our next step now is that we're really now, as we're getting a sense of what the determinants and barriers are to sustainability, we're now getting input from the stakeholders on the ground, all the lay health advisors and project directors, on what strategies, what sustainability strategies should we now be using to actually address some of those barriers. And our next phase of research and funding that we'll be applying for will be to actually test some of those sustainability strategies. So one example, that I'm so excited about, is we co-created a list of about 30 potential sustainability strategies with the site, with all of the sites nationally, and we are now getting input from all of them. This is kind of emerging data. We're not done with data collection, but we're getting data on which sustainability strategies they think are most effective and feasible. So again, this will really drive what we actually use to test as part of our sustainability toolkit. And you can see some examples here in terms of the types of sustainability strategies that we're imagining. Okay, the other thing that's been so fascinating with this work is really thinking about when you're talking about sustainability, and especially if the program has been in place as long as this one has for 30 years, you have to think about issues of de-implementation, especially if the science changes and evolves, it needs to adapt. For this program, the age of screening has changed, the interval of screening has changed, and some of the screening practices have changed. So for example, breast self-exam is no longer part of the evidence base. So we really have also, through this research, tried to understand how are programs adapting or de-implementing or not in the context of sustainability. And one thing that we've recognized, is that knowledge of guidelines, we often think, we'll just educate them on the new guidelines and that will be enough. But really recognizing that there might be a lot of mistrust or distrust of changing guidelines, not understanding why the science is evolving, or not feeling like the new science necessarily reflects their population and their values. So with the group I'm working with, we've seen a lot of distrust of changing guidelines. And we've written a little bit about this if you're interested, on kind of these notions of trust and mistrust as we think about adapting or de-implementing science or programs in the context of sustainability. Okay, so wrapping up, there is so much exciting work on sustainability. We have done a number of kind of big picture conceptual pieces, some chapters that I've put here that I think can provide much more detail, but I'm going to walk you through some of the key opportunities for advancing research on sustainability. So one is this notion we've talked about today of, again, moving away from thinking about sustainability as this finite end goal and recognizing again that it may require much more this dynamic adaptation approach that may include issues of de-implementation as appropriate outcomes. One exciting part, which I'll talk about in just a minute, is I think we have a lot more existing conceptual frameworks to guide this work. So I'm hoping that there'll be much more synthesis in terms of consistency as the research comes out in this area. There's a lot of opportunities for thinking not only about implementation strategies, but sustainability strategies. And again, this is an important future direction, as well as, again, opportunities for prospective research focused just on the sustainability phase. So let's talk for just a minute about some of the frameworks. I want to make sure that you have access to some of these resources. So a couple of years ago, 2018, Shannon Wiltsey-Sturman, Brittany Cooper, and I did a review of about 250 papers on sustainability across a range of types of settings. And we created an integrated sustainability framework, which really brought together and synthesized a lot of the existing literature in terms of which factors at all these levels have tended to matter consistently across a range of types of settings and interventions. So this can often be a starting place for people and then may need to be further refined based on their setting and context. In the annual review paper, we go through, community settings, school settings, clinical settings, global settings, to start to identify where is some of the emerging evidence in terms of the factors that we really need to be thinking about and considering. And I think this is where a lot of the literature is evolving. So, you'll find there'll be reviews just on school-based factors that matter for implementation and sustainability, clinical settings. And we see some consistency in terms of, factors around organizational stability and attrition matter across a lot of these settings. But we're also starting to see that certain factors might be more important than others in certain settings. So there's a really nice review that Juliet has done in global settings in low and middle income countries in sub-Saharan Africa. And she found that the most important determinant in this setting was the extent to which there was community engagement and stakeholder involvement in adaptation of the programs. That had the biggest impact on sustainability. Adam Shoesmith and Luke Wolfenden and Nicole Nathan are doing some amazing, amazing work on sustainability in school settings as well, and really finding the extent to which there's buy-in with the principal and a lot of the organizational leadership is really critical. So again, this is where a lot of the literature is evolving. In the chapter we did in Practical Implementation Science on sustainability, we also have a qualitative guide that people can use that is informed by the sustainability framework we developed. So it can be a starting place as you're just thinking about, again, the factors that you might need to be considering. So that's another resource. The other tool I will share is the amazing work that Doug Luke and colleagues have done at Washington University around the Program Sustainability Assessment Tool, or the PSAT, as well as the Clinical Sustainability Assessment Tool. So this can be used as a measure in terms of thinking about determinants of sustainability. It's a 40-item measure. It can also be used as a planning tool. So you can work with partners. They can kind of fill out the extent to which they think these various factors are in place for sustainability. And then you can identify areas where there might need to be capacity building. Maybe it's the partnerships that need work. Maybe it's the strategic planning. So it's a really nice practice tool as well. And these are all available at sustaintool.org. And here is the clinical capacity one as well. This is just amazing, amazing resource. The other thing I will say is there's a lot of work really thinking about measurement. This has been a huge gap for sustainability. As I mentioned, when I first started doing this work, I really thought about sustainability as just continued delivery of the program. And now, again, recognizing that there are potentially many outcomes that need to be considered, including adaptation, continued health impact, and de-implementation. There has been some really nice reviews of measures that I've put here, both for outcomes and determinants. There's more coming out in this area as well. And a really brief practical measure I'll just flag is the PRESS measure, which is led by Greg Ahrens and colleagues, and it's about provider perceptions of sustainability. So again, a lot of great work. You can see here the PRESS measure is right here, which is openly available. So some nice pragmatic tools as well. In my work, I've also really tried to think about how do we not recreate new frameworks and measures? How can we work from existing ones? So I've partnered with David Chambers and Russ Glasgow, and Russ, has done work on the AIM framework for 30 years or more, which is amazing. And we have an extension of the REAIM framework that kind of extends the maintenance phase to be longer than the initial kind of 6 months or a year, to think about kind of iterative application of the REAIM framework with an eye towards understanding how to address issues and challenges that will have implications for sustainability. So I have you can see here the references and frontiers. And in this article, we list out indicators for thinking about and measuring sustainability as an outcome, and also doing so with a focus on health equity. So again, thinking not just about reach, but thinking about, are all populations equitably reached? Thinking about adoption with an eye towards equity. And again, all the different domains. So there's a lot of great resources out there, and I'd encourage you to take a look at that article if you're doing work on sustainability. Okay, lastly, again, we talked a little bit about the amazing kind of future thinking work that's happening with sustainability strategies. Again, Nicole Nathan and the group in Australia is really leading this work, and there is a new paper that will be coming out hopefully soon that really has us think about which implementation strategies might need to be modified to actually capture issues of sustainability. So that will be coming out. There's been great work that Maji Halamariam has led, again, which has us think about sustainability strategies as distinct from implementation strategies. And again, often this has to do with notions of what's happening over time, right? So it's about continued funding, it's about issues of attrition and staff turnover, et cetera. So these are great resources if you're interested. Okay, and then finally, I'll just say one last word on sustainability and health equity. Often in implementation science, again, we start with our existing evidence base. And I think it's a challenge because sometimes that evidence base has not, again, reflected the populations and settings experiencing some of the greatest health inequities. And I think this is really a challenge for our field to really think about working earlier along the translational continuum and really thinking early and often about both issues of health equity and sustainability if we want to have that long-term impact. We've written about this. There's some nice work that Ross Brownson and colleagues did on revisiting notions of evidence and implementation science, designing for dissemination and sustainability with an equity focus. So again, some just rethinking and revisiting our evidence base and its implications for sustainability. I want to thank community partners from the National Witness Project. And again, lots of challenges in this work, but I also think about how there are just so many opportunities to advance work on sustainability in both research and practice. So I hope you are as excited as I am about this. And I'm always happy to chat, follow up. I know I covered a lot, but hopefully you have a foundation now to work from. So I want to thank my colleagues, collaborators, and funding as well. Thank you.
Dr. Shelton, thank you so much. I mean, this was absolutely a most wonderful overview, giving the state of science on sustainability within implantation research, extremely inspiring, showing where the holes are, the gaps that needs to be filled, and at the same time, also showing your own work, which is truly impressive and certainly makes an impact in the lives of these cancer patients. We come to our discussion part, and this is really the moment where we can deepen our understanding on what has been shown. And I invite everybody either to kind of raise your hand, you always can ask your question yourself, but also you can put your question in the chat, and I will invite the people to ask their question, then you have to unmute yourself. So the first person who asked a question, and I really thank for that, I think it's just fantastic. It's Diyu Wang. I hope I pronounced your name correctly. And could you please unmute yourself and perhaps ask Dr. Shelton what you're interested in?
Yes, thank you very much. Thank you, Professor Shelton, for a wonderful presentation. So I just have a question about actually the funding. I think that's a major challenge. When the funding ends, it's very hard for you to get back to your study site and collect additional data to see how the program goes after all these interventions. So how do you persuade your funders, like sustain or support your initiative? Yeah.
Thank you. That's a great question. In this case, a tremendous amount of time had passed between the initial replication study that happened in the early 2000s, and that was funded by the Centers for Disease Control, and then the work we did on sustainability, which was originally funded about 10 years after that. So there was a big gap. When we made the case, especially, we had a little more flexibility with the foundation that funded us, to be honest, because their funding tends to be a little bit more flexible in terms of how it can be used. We made the case that to do this work, we needed to pay the sites. We needed to pay staff from the community partners, and we needed to pay the project directors and the community advisory board for their time, and that we couldn't do this work without providing that as a minimum, because these programs were already struggling to sustain. So having this additional lift for them in terms of the data collection, was an additional ask. So one challenge we felt, they agreed to that. They thought that from an ethical perspective, it was important that the research, some of the research funding go towards those groups to support their time. The challenge that we faced was some of the reviewers had a lot of questions about, well, then how do you know if you're providing them these funds, isn't that impacting their sustainability? And, kind of this tension of how much are you providing? And I think we paid each site about $2,000. We paid for staff time in terms of percent effort, and then we pay all the participants as well for that. And we made the case that, in the realm of continuing a program, $2,000 is not enough to sustain. That's a drop in the bucket. And so that was critical for that part, but it really wouldn't impact our outcomes. And that's been true. We've seen during COVID, most of them had huge periods of inactivity. So, we made the case that to do this work, we had, to the funder, we had to include the funds to do that well and to have their buy-in. So that's kind of how we made that case. It's hard with smaller grants to do this, right? And some funders are quite restrictive with contracts, but we ended up negotiating this as a contract with a scope of work with all of those sites. And then they could use those funds as needed to support the research.
Thank you so much. So Juliane Mielke, please go ahead, perhaps unmute yourself and also introduce yourself, because it's always wonderful to know, who is online and where the questions are coming from.
Okay, thank you, Sabina. And thank you very much, Dr. Shelton, for this interesting talk. My name is Juliane Mielke, and I'm a postdoc at the Institute of Nursing Science at the University of Basel. And so I really liked your idea about thinking about sustainability as a distinct phase, and the importance of studying sustainability prospectively. And I was wondering what would be a good time during an implementation science project to start thinking about sustainability. because in Basel we think about, or my focus is on contextual analysis, and we see contextual analysis is a foundational phase in implementation science projects, which you do before your implementation project, and which then informs all further phases. So the intervention development, selection of implementation strategies, and also thinking about sustainability. And therefore, I was wondering, what you're thinking about this, when to start thinking
Great
about
question.
sustainability and planning, the study.
Great. Yeah, and it's interesting because a lot of my work has been once the program has already been sustained, but so that was the work I presented. But some of the newer work I've done has started earlier. So I think about it in a couple different ways. One, I think, again, as you're developing the evidence base, as much as you are engaging the partners and the setting and all those considerations about, institutionalization, cost, if you can get those perspectives early on, as you're developing and testing the evidence base, I think that's critical to longer sustainability because you're already thinking about those upfront. So whether, people use different methods for that, user-centered design, community-based participatory research, it can be part of your contextual assessment. There's lots of ways people think about that in the intervention development piece. And so I think that foundation is critical to begin with, because often we're taking these evidence-based interventions that haven't necessarily been developed and tested in those settings. So again, it's often not a surprise to me that we can't sustain them because there has been this disconnect. So I think that's first. Second, I don't think it's ever too early to be asking some of these questions, even in that initial pre-implementation and implementation work, right? Sometimes people might have ideas you could ask in that pre-implementation about what do you think will it take to sustain the program, but they might not. You might ask that iteratively once they actually start implementing as well, because then they'll actually have the experience. And you really want to get that from multiple perspectives, right? The administrator, the leader, all those different levels we think about, because those will all matter. And then finally, I'll say that the program sustainability assessment tool and the clinical sustainability assessment tool, again, sometimes people use those as predictive measures, but I actually think that's a really nice planning tool to really understand in that initial implementation phase, that first 6 months, that first year, what are they learning in terms of what some of the challenges are going to be for building the capacity to sustain, right? And so if one way I've used this is to give this to different stakeholders in different sites, and it can be anonymous and they can complete it. You can get feedback in terms of where they think they need to build, right? It might be around, building partnerships, for example. And so you can get a sense early in that implementation phase to set us up for success for sustainability. What do we need to be addressing? And so doing that built in, right? So that really could happen in that early 6-month year. And then I think my dream is that so many of our implementation studies that we often get funded, that will then have a next phase of funding that will support then just looking at the factors and strategies that matter for that longer term sustainability. Because again, I think we can do that planning, but unless we really have standalone studies that then evaluate, okay, which of these mattered, which of these actually impact longer term sustainability, it's just hard to build the evidence base. So I hope that helps, but I think there's a lot we can do early on.
Thank you very much.
Oh, and the other thing I didn't say is that re-aim framework. That's the perfect kind of tool to be really transparent about when and where along those implementation indicators, those gaps and challenges to sustainability are emerging, right? Is it, what's happening with respect to, are all sites able to implement? Why or why not? Where are the gaps, right? Because that can point to where some of the adaptations and refinements may need to happen for sustainability.
Wonderful. So we have several questions. I will first go to Eleni Zofuli, who I would like just to ask to unmute, if possible, put on the camera and introduce herself, ask her question, if that would be fine for you, Eleni. Please go ahead.
Yes, fine. Thank you. Thank you so much for the initiative. It's a great webinar, and the lecture was a great recap of sustainability. My question, I'm attending from Canada, Montreal, from the other side of the Atlantic. My thesis is on sustainability of mental health recovery initiatives. And the question that I have is in terms of fidelity and sustainability. Mm-hmm. So I guess from your lecture, Rachel, and thank you so much for that, my understanding is that you kind of, you spoke about fidelity as more a sustainability outcome. Mm-hmm. And I'm wondering for specific programs or initiatives, if fidelity should be considered as a key component of sustainability, of how to define sustainability before measuring outcomes or defining outcomes. That's my question. Thank you so much.
Yes, great to meet you. Yes, I do think of that as one potential outcome. So I think sometimes the reality can be tough to do depending on the scale at which you're looking at sustainability. So in the study that I talked about with the 16 sites, pre-COVID, we had planned on doing some observations where we had a fidelity checklist. And we would, we were going to do kind of random selection of different workshops and see what are the extent to which these core components are still in place, right? So that was part of our goal with the idea of thinking about fidelity of the program being an important component. We have moved away from thinking about fidelity and adaptation as opposite ends of the spectrum. So we also had separate questions about adaptation. So you could have high fidelity of the program, but you could also have high adaptation, right? So it may be they're delivering all the core components, but it may be now that they're doing it in a new setting. It may be that they're now also offering HPV vaccination. It may, so we captured separately some of the issues, or we plan to capture it separately some of the issues of adaptation, recognizing that both fidelity and adaptation are central to sustainability. The reality for us, and I think the reality of a lot of programs, is that it can be tough to do the fidelity measure depending on the scale at which you're doing. So we ended up not being able to do the fidelity in person. We had we have a self-report checklist where they say, think about the last time you did this, and the extent to which they delivered all the components. And we kind of just ended up using number of programs as one of our sustainability indicators. So there's kind of like the pragmatic issue, but in an ideal world, it would be great to capture both the fidelity and the outcomes and the adaptation.
Thank you.
Yeah.
Marie Schneider, your hand was up before.
Yes.
Please unmute, show your face, and introduce yourself.
So Marie Schneider from the University of Geneva in Switzerland. Thank you very much, Rachel, for the very interesting talk. Listening to you, you have so much experience in sustainability research, and I was wondering if you could share with us a little bit how you do it, how you start to research your study in sustainability. How do you work? How do you do it? How do you work in your team? Do you have some messages to give us today?
Yeah, that's a great question. I mean, I think for me, sometimes it's hard to jump first to sustainability, right? So it can take a little time. And so that's why I initially focused a lot on the issues of attrition, which so sometimes you might be able to think about some more proximal outcomes as you're building that research program. I would, just put yourself out there and let people know you're interested in this area, because I think A lot of people don't know where to begin on it and might be doing these implementation projects, again, focusing on that early phase, but aren't thinking about that longer term, right? So thinking about conversations, having conversations with people who are doing trials or implementation science studies, and thinking about how you might be able to partner or build that in. If it's not in this early phase, maybe in a later one. Maybe there are ongoing trials people have in implementation science where, you know, you could easily add a question or two, even some qualitative work around some of the barriers or challenges to sustainability. Maybe there's implementation indicators that are being collected at 6 months that you could try and extend, you know, to a year or a year and a half to understand that. So, you know, just thinking about those gaps and opportunities and thinking about moving forward, what those opportunities and partnerships would be. And I think for me, one of the areas that I didn't get to go too much into it, but I think one of the biggest questions for the field, and the question I often get is this really different from implementation? And I think we don't know a lot. You know, can the same frameworks be used for implementation? Are the determinants the same? Are the strategies the same? So I think that's such an interesting gap and opportunity, because I think some of the factors will be the same, right? Things like champions, organizational readiness, a lot of that is consistent. But again, because of this notion of the dynamic nature and some of those issues around attrition, there might be specific determinants. So I think those are some of the important kind of open questions and opportunities to think about.
Thank you very much.
So Rachel, questions are further coming in, and Sada Damusa has a question. Sada, could you unmute yourself and introduce yourself?
So I can't seem to open the video, but can you hear me?
Yes,
we can hear you.
I hear
So
you.
if there is an option for the video, it's fine. Otherwise, introduce yourself and say where you're coming from, what type of work you're doing, because we really want to know, you know, from which context this question comes.
Right. So it kept on saying it's failed to start the video, so I can let me just go ahead.
Yeah.
My name is Dr. Sada Damusa, and I speak from Nigeria. Yeah, so thank you very much, Rachel, for this very interesting presentation. I think for us on this part of the world, funding is really a key issue in terms of sustainability. I know you've talked about it and you've talked about incentives, but I'm just curious, one of the key differences, one of the key findings you mentioned in the Lay Health Advisors Program, the difference between those that are linked to academics and other institutions being more staying longer than the others. So I was just curious, were there any difference in how much they earn? You know, is there a difference between how much they earn compared to the others that didn't have that long stay? And that is even on the project or other sources of income. Have that been considered in the analysis?
Yes, great question. So we looked at the difference between those who were paid versus more volunteer roles. So what I'll say about these roles is almost everyone has about 60 to 80% of the women have full-time jobs, and this is primarily something they do in addition. So none of these are full-time community health workers. About 80% of the programs provide a regular stipend, and most all cover kind of transportation and provide some kind of financial incentive. It varies slightly depending on the program, but they all receive some kind of compensation. Some of them are also more formal roles. So sometimes it's combined. Maybe they're also a navigator, and maybe they're more of a part-time or full-time position. So there's a bit of variation there. We didn't find any variability in terms of because most of them are paid in some extent. There wasn't anything there in terms of whether that predicted the attrition. But what we did find was with that finding with those who were based at the academic center and the cancer centers tended to be more sustained. One thing we found in our qualitative work was that those sites were able to use existing resources, including grants and funding, like internal grants and NIH grants, to cover some of the costs to support the program year to year if that individual program didn't receive extra grants or funding. And so what was sometimes happening is these are short-term grants that support the program often, and it's hard to get them every year. So sometimes programs would be active, they'd lose the grant, they'd become inactive, they'd become active again once they got it again. So those who had those strong partnerships, they were able to cover some of those financial costs during those gap years. So that part really, really mattered. Ones that were more the community standalone weren't able to do that as well because they didn't have those kind of flexible funds to support them. Does that answer that?
Yes, yes. Thank you very much.
Mm-hmm.
Thank you.
So Rachel, currently I do not see other questions or hands. So I have a question for you in terms of the work you're doing within Columbia University and this implementation initiative. How do you go about, and how do you, in general, and how do you address sustainability in that context? Because I'm really also interested in building infrastructures for implementation science. And you have a very specific focus. You come in from the end, you know, the sustainability, which is making your life not easy. But could you kind of tell us a little bit more about what's currently happening in Columbia, how you address this, and how you include the sustainability part?
Great question. Yes. So I'll say I've taught a course in implementation science for 10 years now at our School of Public Health. So a lot of my work is more broader than sustainability as well. We developed this initiative about 4 or 5 years ago. And our first step was we did an assessment and we invited everyone on campus who was either interested in or doing work in implementation science to attend. And what we found is that there were 60 or 70 of us across the university who were either starting to do work in sustainability, had built a program, or were interested in it. But none of us knew about each other. We were so siloed. You know, I feel like that often happens in implementation science where people are doing it but don't know who others are. So this network really started again with that symposium and just identifying and starting to see who was doing what work, what resources did they have, what interests did they have, what expertise. So we started identifying a monthly work group. So we meet once a month. And we really do it as a capacity building opportunity. So we have either senior investigators, mid or early career, and they present what they call a work in progress. And they present a paper in implementation science, a grant, and they get feedback, again, from people who are at different levels of implementation science. And we've had just tremendous success with getting grants published, with really, you know, building capacity through that feedback, because it's very hard in implementation science, as you probably know, to be an expert in everything. It's such a big field. So we find that that combination of the peer mentorship with that more senior mentorship, as well as just referring people out, you know, making connections to people we know are doing work in certain areas and doing that warm handoff and connection just makes such a difference. We also provide capacity building for a lot of the implementation science training programs. So many of us are mentors in those. We help support people's applications for that or review them. So we do a lot around the capacity building. And then we have a monthly seminar series, which is now open. You all are welcome to join those. We record those. We make those available to anyone interested. last year, the last 2 years, we've had a theme of health equity and implementation science. This year, we're doing a big focus on methodologies. So we're happy, again, if anyone's interested in that, those are available. And then we also have a consultation service and a pilot award to support all of this. I find that a lot of people are not doing work in sustainability, but are interested in it. So I have done talks, I have a video series. So I often introduce people to this idea, but it's often where people are in their work, they're not quite there yet. So I often have people kind of map out, think about your next implementation science grant, and then your next grant after that. What is the trajectory? And so kind of have people thinking about it early, because most people are not there yet in terms of where the timeline of their work is. But it's exciting. It's a great group, and it's really energizing to kind of learn from and support one another.
But it feeds in also again in the whole funding environment, where we, in a lot of cases, are not living the new research paradigm of working towards true impact, but primarily to impact factors, where the research is stopping with efficacy, perhaps effectiveness, certainly not implementation. The sustainability part, and it has been addressed in your lecture, it has been addressed by some who ask questions, is one which is in the funding pipeline truly a challenge. Nevertheless, what you also addressed, that it's more than just the monies available. There is much more that is contributing. And here I would like to come to the fact that in the end, it is not different phases. It is not kind of, you clearly said it's multi-level. So you have a very complex system. I mean, it's a very complex system. And sustainability is, in the end, a result of many, many, many factors that interact among each other. Do you know anybody who is using system science as part of sustainability?
Yes, I did not get to that slide. I went through it quickly because I was running out of time. But so we did a systematic review in social science and medicine. It's in my slides, where we looked at how social network analysis is being used to inform different aspects. We looked at dissemination, implementation, and sustainability. And there, there is a little work happening in that space, but not much, a big gap. Doug Luke, who does the SUSTAIN tool and the PSAT, the Program Sustainability Assessment tool, he also does a lot of work on system science. So I don't know if he has funded studies in this area, but I imagine if anyone is to do that work, it would be that group. But I think the system science piece, especially if we think about the complexity, like you said, the adaptive nature, sustainability work is just so ideal for doing the system science work. So I'd really encourage people who are earlier in their career to think about opportunities for that, because that work has not been apparent in the field, and I think it's a tremendous opportunity.
So I just would like to give a last chance to the audience to ask their questions, give their remarks, give a feedback before we come to closing this webinar of a Swiss Implementation Science Network today. I cannot see all the people, but is there any hands up at the moment? Juliane?
Looks like there's one question from Freddie about that. Yes, I will definitely share the slide. I mean, I don't know if you all send the slides or reach out to me. I'll put my
Juliane Barnick will make sure that recording as well as the slides will be available to all those who registered to the seminar, meaning that you can, of course, those who were part of the webinar today, it was synchronous, but a lot of people also are listening asynchronously, and so that gives an opportunity to also to re-listen, which I certainly will do to what has been said. So, Dr. Shelton, dear Rachel, absolutely brilliant, wonderful. I think that you're a trailblazer within implantation science with the work which you're doing. We truly hope that you know, what you brought was not only an insight in sustainability, but also positioning sustainability as a phase within implantation science that need to be considered already early on, and that has also a lot of complexity. This is in the end the ultimate goal, and we hope that we all can work together in order to strengthen the methodology. But we also have to think, as you said, and also told to your students, you know, early on, thinking through, you know, what could be so many grant, you know, the next grant in order to kind of achieve this. So it is, we are truly grateful you were with us, and I think that you also, Juliana Barnik, who we thank for organizing this webinar logistically together with Juliane and Mielke, that they also add the email of Dr. Shelton. I think it's on the slides so that there is really a communication possible. Absolutely wonderful. And so coming to the end of this webinar, we would also like to attend you on our next webinar. And Juliana Barnik, if you could share the slides, thank you so much. So we will move forward and we will have our last webinar coming up in December, which will be focusing on using artificial intelligence to facilitate the implementation of services in community pharmacy. So this is a webinar which is not only interesting for pharmacy, but is really also the future. The use of artificial intelligence, big data, as this might really make interventions more implementable if you don't have to do too much data collection, and even can use this data to guide you in your process. It will be Dr. Victoria Garcia Cardenas, who is at the University of Technology in Sydney, Australia, and we truly hope to meet you again. Thank you for joining the Swiss Implantation Science Network. We are on social media. You can find us on our webpage, and we are sending out regularly all possible information. Rachel, I also asked Juliana Mielke, who is responsible for social media, to also advertise the seminars of Columbia University so that people also can see what is being offered there. The world is just one interconnected group, and especially in implantation science. So thank you very much again, and hope to meet you all again in December online. Bye-bye.